Well, you know him as Dr. Diet, and we're changing that to Dr. Diabetes. Dr. Stanford Owen with the Center for Health Management. How are you? It's good to see you.
Great, good to be here.
Give us why. I mean, of course, diabetes is #1 problem as far as health issues in Mississippi, and type 2 diabetes, big issue.
Right. Diabetes is the primary disease that I treat with nutrition therapy, and we get excellent results. It is the primary treatment for all type 2 diabetes, so that's where our focus is going.
What causes type 2 diabetes?
So diabetes is caused by food, okay? Pure and simple, it's caused by food. Specifically, animal fats combined with starch causes type 2 diabetes. So pork, beef, dairy, combine it with wheat, corn, rice, potatoes, starch, you have type 2 diabetes.
So eating a lot of candy is not good for you.
Any simple sugars and especially animal fats combined with carbohydrates is really the cause, and we understand why that occurs now.
Okay, so what are the treatments now for type 2 diabetes?
All right, so the treatments have been for 30 years. Nutrition therapy is the primary treatment by every textbook, by the American Diabetes Association, by the Centers for Disease Control, by the National Institute of Health. The problem is most patients don't get 12 weeks of intensive nutrition therapy. If that fails to control patients, then we add oral diabetic medication. Sometimes we'll add appetite medication to help comply with the diet. If that fails, we have some new injectable hormones that can help. And if that fails, bariatric surgery.
Now, is insulin, I mean, you always hear about insulin. Is insulin something that you use to treat type 2 diabetes?
So type 2 diabetes is caused by your body's resistance to insulin. Your pancreas works harder and harder like a weightlifter, trying to make more and more insulin to cells that don't respond to it, and eventually the pancreas gets pooped and fails. That's what type 2 diabetes is. Why would I add insulin to that regimen? So insulin in my clinic has no place in the treatment of type 2 diabetes. If patients require insulin, I've failed, and we get 90% of our patients off insulin.
So what are some of the symptoms that patients suffer from with type 2 diabetes?
So common symptoms: fatigue from cellular metabolism problems and sleep apnea, breathlessness because the cardiovascular system is pooping out, edema because the kidneys and the heart are not functioning as well, joint pain and nerve pain in particular because of inflammation, depression because the brain can't work real well when the nerve fibers are not processing sugar.
Now, you mentioned that the response is fast. I thought, and like we're talking days, weeks, I thought you had to lose a lot of weight.
No,
most
of our patients respond in 3 to 7 days. Those symptoms I just mentioned, fatigue, breathlessness, joint pain, so forth, patients notice a difference in 3 to 7 days. And the reason is the fat cell can start normalizing in as little as 3 days to a week.
Well, we mentioned PrescriptFit and the nutrition strategies that they work fast. You brought a chart with us, with you today. Talk about this if you would.
All right, so this is Bubba, okay?
The fat cell.
Bubba's an angry fat cell. Now, if you stand up and you look down and you can't see your feet, Bubba and his friends are very angry, and they're producing large amounts of hormones that not only cause type 2 diabetes, but most of the diseases that you have to treat. We can make Bubba happy and literally in hours and days by changing what we feed Bubba. So our goal is to make Bubba not only function better, but go from an angry fat cell producing many toxic hormones to calming it down to a happy fat cell that's not producing toxic hormones, actually produces beneficial hormones in as little as a week.
Wow.
Yes. So
let's talk about a little bit more about this chart. You've got things lined up: heart disease, arthritis, stroke, aging. These are all things that you're fighting.
So the fat cell, when it's fed animal fats combined with starches, produces at least 50 different hormones. Some of these hormones cause diabetes, some of these hormones cause heart disease, some cause arthritis, some affect the brain and cause depression. So the common link to all of these conditions is Bubba and the foods that you feed Bubba. It's not hard. I can teach any Bubba how to make his fat cells happy.
And of course, we have a lot of Bubbas. Well, Mississippi, #1 in obesity, #1 in diabetics. So there's a lot of Bubbas out there.
Correct. And there's only 3 things that Bubba has to do. Number 1, get liquid calories out of their life: soda, juice, milk, sweet tea. That's relatively easy. number two, manage those toxic foods, the animal fats with the carbohydrates. And number three, add lots of foods that make Bubba happy: seafood, poultry, non-starchy vegetables, eggs, nuts, whole fruit. And then what we finally do is give Bubba PrescriptFit, and that's what really makes him happy.
Well, okay. Is this treatment, PrescriptFit, is it an expensive treatment?
No, it's not expensive, and again, I designed this primarily to treat type 2 diabetes. So the care we offer in the clinic is $48 a month. That gives you unlimited access to me if I need to see you every week, if I need to see you once a month, whatever. Nights, weekends, $48. And the PrescriptFit itself is about $8 a day. Now, the average American is spending right now $19.96 a day on food.
Wow.
Yeah,
So that's like breaking it more than in half.
Correct. You cut your food cost in half. Certainly, you cut your medication cost, hopefully by half or more.
It's just amazing that people don't realize that how changing your diet and just little things. I was about 20 pounds overweight, and I cut out breads, glutens, sugars, sweets, and a lot of things. People say, "Oh, I'll drink diet drinks." That's even worse.
Animal fats with carbohydrates. It's that simple, and that's the only change. And those foods don't need to be excluded permanently.
No.
Once the diabetes is under control, we add those back in what we call splurge meals, 2 or 3 times a week. That won't break the bank.
I call them cheat meals.
We call them splurge meals.
Yeah.
Okay?
Because actually, what it does too, a lot of times, is when you do that, when you follow this, and you have your little splurge meal a couple times a week, your metabolism is like freaks, and it starts working harder, burning faster, and makes Bubba a little bit smaller.
Well, we're animals of anticipation. We like anticipation. The gaming industry is built on anticipation. So what we do is we add a food group one at a time so that you're anticipating adding a food group to your diet every couple of days or every week or so.
Right.
And it makes patients very compliant. They see results. They feel better. And then they come, if they deviate, if they splurge too long or too much, they always come back because they feel bad again.
Yeah.
Very quickly.
It's amazing whenever and how much better that you feel when you follow this. Give us real quick your locations.
So we have 2 locations in Gulfport and D'Iberville, Monday through Friday, 9 to 5, and then, of course, nights and weekends if you need me.
Okay, and also the phone number is on your screen. You can give them a call. 864-9669 is the number. DRONMD@drdiet.com. Send them an email. If you want to get yourself on the straight and narrow, give them a call.